I think one of the things that like came to mind when you were talking about that is, somebody who's got essentially your level of experience. Like y'all, I would be, been practicing about the same number of years, but we used to approach things like an open tibia fracture. That used to be done differently, right? You would wash them out. You wouldn't put any hardware in, right? Because you were worried about infection. And then we get this traumatologist who comes online and again, great experience, great training. And he's like, no, actually the studies show if you just wash them out and go ahead and do the fixation, there's no increased, long-term risk for infection. They tend to do about the same. And you're saving that patient from a potential, additional surgeries. You're stabilizing the fracture so they have less pain. And that was like a changing point for our practice where we stopped, doing it this way because this was the way that, I was taught, you were taught that we should do it and transition to a better way that has affected our and it's backed by evidence-based medicine, but from somebody we respect and who also the reason that we trusted that took it further is why, because that specific surgeon practices with humility. He practices from an area where you can tell every patient that he takes to his operating room, he thinks of them as that individual person. And that's what gets you that foot in the door to collaborate. Because somebody's, a little bit of a different type of leader, so to speak, or a different type of surgeon. I'm not going to, it's harder to trust that.
Right. I agree.
So.
I agree with you 100%.
Right.
I mean, but I'm fortunate enough to have great colleagues that I get to work with who are very, very skilled, who know and understand what they're doing. They're excellent at their jobs, and they're willing to share not only their successes, but also times when they fell a little bit short. And I think that's a piece where if it's easy, especially in private practice, if you have something that doesn't go perfectly, to kind of let that sort of be hidden in the background. And having colleagues and who are willing to show, hey, I could have done this better, right? Or hey, what would you have done to fix this a little bit better, or a lot better even? And having that courage and that humility to show when the X-rays don't look exactly perfect, or when things don't turn out exactly how you needed to, though, that changes everybody's practice and makes people better and better and better. And I think that's really, really good. And we have that. I mean, we have super highly skilled folks here, but who are also willing to share and willing to show, hey, here's what, and willing to be open to saying, hey, how would you have done this? Would you plate this humerus? Would you fix it with a nail? What would you do? And people listen, and people don't always agree, but you can have a really high quality conversation about how to do something without becoming personal, without it becoming difficult, without it becoming even uncomfortable. I mean, to sit down and say, here's how you would do it, here's how I would do it, let's move forward. Now everybody in the room knows there's two different ways to do it and go from there.
Right.
So